All India Radio presents Morning News. Good morning. I'm Sunil Verma, and with me is Vaibhav Jyotsna Srivastav. The headlines. Home Minister Amit Shah to chair an all-party meeting today to review management of coronavirus in Delhi. Centre orders house-to-house health survey in containment zones of the national capital to improve contact mapping. Delhi government withdraws its order declaring all nursing homes with bed strengths between 10 and 49 as COVID-19 hospitals. Train services at Delhi's Anand Vihar terminal suspended. All platforms to be reserved for deployment of isolation coaches for corona patients. An earthquake of 5.3 magnitude rocks parts of Gujarat. No report of any major damage to property or loss of life. Home Minister Amit Shah has convened an all-party meeting today to review the management for coronavirus in the national capital. Home Ministry has invited leaders of the Delhi-based parties, Bharatiya Janata Party, Aam Aadmi Party, Congress and Bahujan Samaj Party for the meeting. Union Health Secretary, Delhi Chief Secretary and Principal Secretary Health of the Delhi government will also attend the meeting.
Home Minister Amit Shah has directed central government, Delhi government and all three municipal corporations of Delhi to ensure proper implementation of house-to-house survey and corona testing to the lowest level. Mr. Shah said this while chairing a meeting in New Delhi with the Union Health Minister Dr. Harshvardhan, Delhi Lieutenant Governor Anil Baijal, Chief Minister Arvind Kejriwal, mayors of the three municipal corporations of Delhi and senior officers to review the COVID-19 situation in the national capital. He said the main aim of this meeting is to win the fight against corona with mutual coordination. Home Minister said we have to make the country and the national capital corona-free, healthy and prosperous at the earliest. The Home Minister also directed the Delhi Police Commissioner to ensure all guidelines are enforced strictly.
Union Health Ministry has directed that the bodies of suspected COVID-19 cases will be handed over to relatives immediately without waiting for lab confirmation. The bodies will be disposed of with precautions as per Ministry's guidelines. This direction came in compliance of Home Minister Amit Shah's order in this regard. As per Home Ministry's directions, AIIMS Delhi has set up a 24/7 COVID-19 helpline number. Contact AIIMS 911-544-4155. The callers can take OPD appointments and talk to volunteers while doctors can talk to consultants through this number. The Health Ministry has also set up 3 teams of 4 doctors each from AIIMS Delhi, DGHS, Ministry of Health and Family Welfare and Government of Delhi, assisted by MCD officials in accordance with the Home Minister's directions. The teams will inspect major dedicated COVID-19 facilities proposed in Delhi and make recommendations for improvement.
Mr. Amit Shah has said that the Narendra Modi government is committed to check the spread of COVID-19 in Delhi and keep the national capital safe. He said that the COVID-19 testing in the national capital will be doubled within the next 2 days and tripled after 6 days in order to check the coronavirus spread. The Home Minister chaired a meeting to review the COVID-19 situation in Delhi, which was attended by Health Minister Dr. Harshvardhan, Delhi Lieutenant Governor Anil Baijal, Chief Minister Arvind Kejriwal and other senior officers. Several important decisions were taken to ensure safety of the citizens of Delhi against the infection. Mr. Amit Shah said, in view of the scarcity of beds for corona patients in Delhi hospitals, the centre has decided to immediately provide 500 converted rail coaches to the Delhi government. With this, 8,000 more beds will be available in Delhi and these will be equipped with all facilities in the treatment of COVID-19 patients. Mr. Amit Shah has directed immediate transfer of 4 IAS officers to New Delhi to assist Government of Delhi in management of COVID-19. The officers are Avnish Kumar and Monica Priyadarshini, who are presently posted in Andaman and Nicobar Islands, and Gaurav Singh Rajawat and Vikram Singh Malik, who are posted in Arunachal Pradesh. The Home Minister also directed for attachment of 2 senior IAS officers to Delhi government from the centre. The officers are SCL Das and SS Yadav.
The Delhi government has withdrawn its order mandating all nursing homes in the city with bed strength between 10 and 49 as COVID-19 nursing homes. The city government had issued such an order on Saturday. Delhi government had also asked all such nursing homes to make their COVID beds functional within 3 days of the issue of the order. Only standalone exclusives, eye centers, ENT centers, dialysis centers, maternity homes and IVF centers had been exempted as per the earlier order. Delhi government had taken this decision to avoid intermingling of COVID and non-COVID patients in small and medium multi-specialty nursing homes and to increase the bed capacity for COVID-19 patients. Cases of coronavirus are increasing in Delhi in a rapid manner. In view of the rising coronavirus cases in the national capital, the central government has suspended all train services at Delhi's Anand Vihar railway station from today. A railway official said all platforms at Anand Vihar terminal will be reserved for the deployment of isolation coaches for COVID-19 patients. 2 trains with special COVID-19 coaches have already arrived at the railway station. All 5 trains running from Anand Vihar station will now operate from Old Delhi railway station. Home Minister Amit Shah has said these railway coaches will not only add another 8,000 beds in Delhi, but this coach will be equipped with all facilities to fight the corona infection. The recovery rate of COVID-19 patients has improved to over 50% in the country. Over 8,000 COVID-19 patients have been cured in the last 24 hours. So far, 1,62,378 patients have been cured. In a statement, Health Ministry said, the recovery rate indicates that of all the cases of COVID-19, half of them have recovered from the disease. Timely case identification and proper clinical management has been the road to recovery. Currently, 1,49,348 active cases are under medical supervision. ICMR's testing capacity for detecting the novel coronavirus in infected persons is continuously being ramped up. The number of government labs has been increased to 646 and private labs has been increased to 247.
As part of Mission Sagar, Indian naval ship Kesari returned to Port Louis, Mauritius yesterday to embark the Indian Navy medical team, which is disembarked on the 23rd of May 2020. The 14-member medical team comprising of specialist doctors and paramedics was disembarked at Port Louis with an aim to assist in management of COVID-19 pandemic, share expertise to help contain the spread of the disease and minimize the risk to life. Mission Sagar is in line with India's role as the first responder in the region and builds on the excellent relations existing between the two countries to battle the COVID-19 pandemic and its resultant difficulties. You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Home Minister Amit Shah to chair an all-party meeting today to review the management of coronavirus in Delhi. Centre orders house-to-house health survey in containment zones of the national capital to improve contact mapping. Delhi government withdraws its order declaring all nursing homes with bed strength between 10 and 49 as COVID-19 hospitals. Train services at Delhi's Anand Vihar terminal suspended. All platforms to be reserved for the deployment of isolation coaches for corona patients. And an earthquake of 5.3 magnitude rocks parts of Gujarat. No report of any major damage to property or loss of life. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
In Chennai, a COVID-19 micromanagement plan has been rolled out in all its 200 divisions to contain the spread of the disease. As part of the new plan, medical camps are being held in multiple locations from where unknown COVID-19 cases could be identified. Besides, surveillance of vulnerable people and asymptomatic patients also form part of the revised plan of action in the city. Our correspondent reports that the recovery rate in the state is estimated to be 55.9% and the mortality rate is 0.97%.
In a positive development in Tamil Nadu, the number of private doctors volunteering to offer their services in treating COVID-19 patients at government facilities is increasing. The State Health Minister Dr. Vijay Bhaskar has said 120 more private doctors have registered themselves. He said several staff nurses and other paramedical staff also on their own prefer duty in COVID-19 ward to wage the war against the virus. He also said telecounseling through video call under the E-Sanjeevani initiative is helping to boost confidence in the patients and their family members, as the confidence level plays a vital part in the clinical management of the disease. Jai Singh, AR News, Chennai.
In Gujarat, the number of COVID-19 cases has gone up to 23,017, with 511 new cases reported in the last 24 hours. 29 patients have lost their lives, taking the death toll to 1,478. Our correspondent reports that 442 patients were discharged yesterday after recovery.
Following the discharge of 442 patients yesterday, the total number of patients recovered from COVID-19 has gone up to 16,333. According to official sources, out of 5,779 active cases in the state, conditions of 5,713 are stable, while 66 patients are on ventilator support. Out of 511 new cases reported yesterday, the maximum 334 cases reported from Ahmedabad alone. Sources said that more than 288,000 tests have been carried out in the state till date. Meanwhile, Chief Minister Vijay Rupani said that government is not considering to reimpose lockdown again in the state. Yogesh Pandya, AR News, Ahmedabad.
With the growing number of corona cases in the state, Uttar Pradesh government has appointed special teams of senior administrative and medical officials to curb the spread of the virus and review medical facilities in 11 districts. These are the districts where a high number of fresh cases is being reported. These dedicated officers will file their report within 5 days. More from our correspondent.
Chief Minister Yogi Adityanath yesterday held a meeting with the newly appointed nodal officers for 11 districts and asked them to make serious attempts to break the infection chain and control the spread of coronavirus. The districts where special teams are being sent are Agra, Meerut, Kanpur Nagar, Aligarh, Gautam Budh Nagar, Noida, Ghaziabad, Muradabad, Firozabad, Bulandshahr, Jhansi and Basti. In these 11 districts, Agra is the only district of a state where total COVID cases have surpassed 1,000 mark, while Gautam Budh Nagar, Noida is having 997 cases till date. The Chief Minister directed the nodal officers to submit a report of the factors behind the spurt in infection and mortality rate in these districts within 5 days. The teams have also been asked to focus on the surveillance system in these districts and the management of hospitals there. Sushil Chandra Tiwari, AIR News, Lucknow.
In a first of its kind, the civic-run Nair Hospital in Mumbai successfully completed 302 deliveries of COVID-19 positive women. The birth of the 302nd baby yesterday spread cheer in the Nair Hospital. Significantly, doctors said none of the babies born in the last 2 months have tested positive at the time of the birth. We have a report from our Mumbai correspondent.
Over 300 healthy babies, including triplets and a pair of twins, were born to around 302 COVID-19 positive mothers since the center performed its first delivery on 14th April. The Nair Hospital, located at Mumbai Central, was declared a COVID-only hospital on 18th April and eventually set up a large 120-bedded ward for COVID-positive pregnant women. Dr. Surbhi Rathi, Professor of Pediatrics, said at any point of time, the ward has about 60 women who have just delivered their babies and 30 women who are about to deliver. 8 obstetricians under Dr. Neeraj Mahajan, nodal in charge for the Center for Positive Mothers, work round the clock in 6-hour shifts with 2 doctors to each shift. Dr. Sushma Malik, head of pediatrics gynecologist, said a few babies have tested COVID positive about 5 to 6 days after delivery, but it was more due to the handling of those babies by multiple relatives. However, she added that these babies too have recovered. Ultimately, all babies born at the hospital have been COVID negative at birth and at discharge. Sweety Jain, AR News, Mumbai.
Meanwhile, selected local train service is resuming in Mumbai from today for the essential staff. General passengers will not be allowed to travel in the special service trains. Select local train service is resuming from today for essential staff. General passengers won't be allowed to travel in the special service trains.
In Madhya Pradesh, Chief Minister Shivraj Singh Chauhan instructed that full help of the community should be taken to prevent spread of coronavirus infection in the state. He had directed the Health Department to prepare an effective system in this regard. More from our correspondent.
The Madhya Pradesh Health Department has proposed to rope in volunteers as COVID Mitra to help the government in containing the spread of coronavirus in the state. The COVID Mitra will be equipped with an oximeter to check the oxygen levels of people. Any healthy individuals up to 45 years of age or a social volunteer organization in an urban areas can be made COVID Mitra. The Health Department also advised to the people to download Sarthak Lite app to get information about the nearest COVID-19 treatment facility and sample collection centers. Sanjeev Sharma, AIR News, Bhopal.
In Manipur, the State Health Department has set up an outreach team to take care of the elderly persons of old age homes, considering the increased number of positive cases in the state. The outreach team of the State Department has been visiting 8 old age homes located in different districts of Manipur. The team also distributed medical masks and hand sanitizers to the inmates of homes and gave awareness on COVID-19.
Telangana government has decided to scale up coronavirus testing, especially in Hyderabad and surrounding 4 districts. Also decided to allow for the first time testing and treatment in private laboratories and hospitals as per the ICMR guidelines. Chief Minister K. Chandrasekhar Rao has taken a decision to this effect at a review meeting held in Hyderabad last evening. 50,000 COVID-19 tests will be held in 30 assembly constituencies, including those in Hyderabad in the next 10 days. The Chief Minister also directed the officials to formulate the guidelines and rates for conducting the tests and treatment for those who are tested positive.
The Bihar government has decided to discontinue block-level quarantine centers from today. Anupam Kumar, Secretary to Chief Minister, said migrant workers will now be sent to home quarantine and their health will be monitored daily. Meanwhile, the number of recovered patients in the state has surpassed the positive cases. During the past 24 hours, 289 patients have recovered, while 186 new cases were reported. The recovery rate has gone up to over 61%. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts in COVID-19. Talking to AIR News, Dr. Amar Chand Bajaj, Senior Consultant in Sitaram Bharatiya Institute of Science and Research, New Delhi, highlighted the importance of hygiene and how to maintain it to contain the novel coronavirus.
जब तक हमारे पास इनकी ट्रीटमेंट वैक्सीन या मेडिसिन के रूप में ना निकले तब तक हमें जो प्रिकॉशनरी मेजर्स है वो फॉलो करने हैं। जहां जरूरत ना हो उसमें घर से बिल्कुल बाहर ना निकले, कोशिश करें कम से कम बाहर निकलना है। और जबकि निकलना भी पड़ा घर से बाहर तो कोशिश करें कि जहां आप 2 लोग खड़े हैं करीब 2 मीटर दूर खड़े रहें, नहीं तो कम से कम 1 मीटर दूर खड़े रहें।
Dr. Naresh Gupta of LNJP Hospital, Delhi, emphasized on the importance of breaking the chain of transmission.
This will save you from dozens of other viruses that cause cold and many other diseases. Physical distancing, social distancing is very important in breaking the chain of transmission.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1800 5767. You can also ask questions on the telephone number 011 2331 4444 and post queries on our Twitter handle @AIR News alerts by #AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on Air Official. You can also follow us on the News on Air app for updates.
Amidst corona crisis, the Prime Minister's office has played a significant role in solving the problems of the citizens. Arvind Banerjee, a resident of Bhilai city of Chhattisgarh, said that his daughter Anushri was stranded at Kota in Rajasthan during the lockdown. He requested the PMO and his grievance was redressed in a timely fashion.
मेरी बच्ची कोटा में पढ़ रही थी। इस लॉकडाउन के समय जो है वो वहाँ पे फंस गई थी, तो उस समय मैंने पीएमओ ऑफिस में एक ग्रीवेंस लॉन्च कराई कि बच्चों को इवैक्यूएट करने का कुछ प्रबंध किया जाए। पीएमओ ऑफिस से बहुत अच्छा इनिशिएटिव लिया। तीनों गवर्नमेंट ऑफ छत्तीसगढ़, गवर्नमेंट ऑफ राजस्थान और पीएमओ ऑफिस ने बहुत अच्छा समन्वय स्थापित किया और बच्चों को वहाँ से उन्होंने निकाला। बच्ची हमारी सुरक्षित घर में आ गई। पीएमओ ऑफिस का बहुत बहुत धन्यवाद। मैंने उनको जिस दिन हमने ग्रीवेंस लॉन्च कराया था और जिस तक हमारा ग्रीवेंस रिजॉल्व हुआ तब तक जो है वो कंटिन्यूज ट्रैक करते रहे। मैं नरेंद्र मोदी जी का, भूपेश बघेल जी का बहुत बहुत हृदय से आभारी हूँ।
There is a fake message being passed around with link to a Google form allegedly by All India Council for Technical Education seeking inputs from students of universities on conduct of exams. In a tweet, Press Information Bureau clarified that AICTE is not conducting any survey and this form is fake.
More than 7.8 million cases of the novel coronavirus cases have been confirmed worldwide, including 4,31,236 deaths so far. According to Johns Hopkins University, US is reporting the highest number of cases, followed by Brazil and Russia. Beijing's Health Commission have also confirmed 43 cases linked to the largest agricultural market in Beijing, breaking the city's 56-day record of no new coronavirus cases.
The Government of India will organize 4 more courses on various aspects of managing the COVID-19 pandemic for professionals in Bangladesh. Announcing this on Sunday, the High Commission of India in Dhaka said that these courses are part of the Indian Technical and Economic Cooperation ITEC platform aimed at capacity building for professionals engaged in the COVID-19 pandemic management in Bangladesh. The courses will be conducted between June 18 and June 26th. Earlier, starting from 17th of April, 6 courses on various aspects of COVID-19 management have already been conducted by leading institutions. India's first infectious disease diagnostic lab is now ready. This rapid response mobile laboratory is part of the government's Atmanirbhar Bharat. This laboratory was built in a record time of 8 days from the date of receipt of automotive chassis from Bharat Benz. It is built with the support of Department of Biotechnology. The lab is BSL-2 facility with on-site ELISA, real-time reverse transcription polymerase chain reaction test and biochemistry analyzers. This lab can test ELISA about 200 per day and RT-PCR about 50 per day.
In the Union Territory of Jammu and Kashmir, Kashmiri Pandits staged a peaceful rally in Jammu yesterday against the recent killing of a sarpanch from the community and demanded adequate security for all minorities living in the Kashmir Valley. Sarpanch Ajay Pandita was shot dead by terrorists in South Kashmir's Anantnag district on June 8th. A daughter of the Sarpanch attended the rally, which was taken out under the banner Kashmiri Pandit Volunteers. The participants wore black badges, chanted slogans against terrorism and Pakistan, and urged Lieutenant Governor G.C. Murmu to ensure foolproof security to all minorities living in Kashmir, especially Kashmiri Pandit youths, who got jobs under Prime Minister's employment package and are working at different places in the Kashmir division. They also demanded formation of a commission for delivery of justice to Pandits, concrete policy for their return and rehabilitation, and a plan for revival of temples, shrines and other religious places in the Kashmir Valley. An earthquake of 5.3 magnitude shook parts of Gujarat at 8:30 p.m. last night. The epicenter of the tremor was located near Bhachau in Kutch district. In Rajkot, Ahmedabad, Kutch and Patan, many people rushed out of their houses. There is no report of any major damage to property or loss of life. However, some houses in Kutch and adjoining districts developed cracks. Chief Minister Vijay Rupani held a telephonic conversation with collectors of Kutch, Rajkot and Patan districts that are located close to the epicenter of the quake. He directed the collectors to report damage, if any, and activate disaster management cell. Southwest monsoon has further advanced into remaining parts of Central Arabian Sea, some parts of the Northeast Arabian Sea, Gujarat, Dadra and Nagar Haveli. It has also advanced to the remaining parts of Maharashtra, including Mumbai, some parts of Madhya Pradesh, most parts of Chhattisgarh and Jharkhand, and some more parts of Bihar. Met Department said conditions are becoming favorable for further advance of the southwest monsoon into some more parts of the North Arabian Sea, Gujarat and Madhya Pradesh, remaining parts of Chhattisgarh, Jharkhand and Bihar, and some parts of East Uttar Pradesh during the next 48 hours. We spoke to R.K. Jainamani, head of forecasting at the India Meteorological Department.
साउथ वेस्ट मानसून जो है पूरी जोर पर है और आज जो है एंटायर महाराष्ट्र कवर हुआ है और गुजरात का भी जैसे सूरत वलसाड सारा डिस्ट्रिक्ट कवर हुआ है। देन मध्य प्रदेश का कुछ हिस्सा बहुत सारा जगह जो है छत्तीसगढ़ झारखंड बिहार। तो आज जो लेटेस्ट है वो पूरा जो सेंट्रल अरेबियन सी कवर है सूरत देन महाराष्ट्र का जो नॉर्दर्न मोस्ट जो नंदुरबार डिस्ट्रिक्ट है वो भी कवर है। उसके बाद बैतूल अंबिकापुर और गया पटना। सो ये जो है नॉर्दर्न लिमिट ऑफ द मानसून। तो जहां तक रेनफॉल परफॉर्मेंस है जो सीजनल है ऑल इंडिया डिस्ट्रीब्यूशन 34% है। काफी अच्छा बारिश रिपोर्ट हुआ है अप टू सेंट्रल इंडिया।
Now let us take a look at the weather forecast for today. The national capital Delhi will witness a minimum temperature of 28 and maximum of 42 degrees Celsius. The sky will be partly cloudy with possibility of development of thunder and lightning. Mumbai will witness generally cloudy sky with heavy rain. The minimum and maximum temperatures will hover between 24 and 31 degrees Celsius. In the south, Chennai will see generally cloudy sky with light rain or drizzle. The temperature will be between 29 and 40 degrees Celsius. Kolkata will witness generally cloudy sky with a few spells of rain or thunder showers. The minimum temperature in the metropolis will be 27, while maximum will be around 30 degrees Celsius. On to the north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 24 degrees Celsius in Jammu, while the maximum will be around 38 degrees Celsius. The city will observe mainly clear sky, becoming partly cloudy towards afternoon or evening. In Srinagar, the temperature will be between 14 and 29 degrees Celsius. The city will face mainly clear sky, becoming partly cloudy towards afternoon or evening. In Gilgit, the temperature will hover between 15 and 30 degrees Celsius, with the sky becoming partly cloudy, with a possibility of rain or thunderstorm or dust storm. In Muzaffarabad, the sky will be mainly clear, becoming partly cloudy towards afternoon or evening. The city will witness the minimum temperature of 18 degrees Celsius, while maximum temperature will be around 36 degrees Celsius. Prime Minister Narendra Modi has urged people to send their ideas for this month's Mann Ki Baat. In a tweet, Mr. Modi said, Mann Ki Baat is a vibrant platform that showcases the strength of 130 crore Indians. He said, though Mann Ki Baat is 2 weeks away, people can send their ideas by recording their messages, dialing 1-800-117-800 and writing on the Namo app.
And now an overview of today's newspapers. Testing to be ramped up in the capital, says Amit Shah. Headlines The Hindu. 500 coaches with 8,000 beds for Delhi, testing to triple in 6 days, spells out the Home Minister, writes The Tribune. Coronavirus peak could come about in mid-November, claims a report by the Indian Council of Medical Research, as reported by The Pioneer. Hindustan Times reports 13% more sowing points to a bumper Kharif crop, indicating that the agriculture sector has largely escaped the impact of COVID-19. MP, Rajasthan, Punjab show positivity rate below 3%, indicating that the states have managed to slow the incidence of COVID-19, reports the Times of India. On the death by suicide of actor Sushant Singh Rajput, the Times of India headline reads, Young star Sushant Rajput cuts short a bright future. And finally, a climate change assessment report by the government indicates that the average temperature in India is projected to rise by 4.4 degrees Celsius, reports the Times of India.
And now, before we end the bulletin, the headlines once again. Home Minister Amit Shah to chair an all-party meeting today to review management of coronavirus in Delhi. Centre orders house-to-house health survey in containment zones of the national capital to improve contact mapping. Delhi government withdraws its order declaring all nursing homes with bed strength between 10 and 49 as COVID-19 hospitals. Train services at Delhi's Anand Vihar terminal suspended. All platforms to be reserved for deployment of isolation coaches for corona patients. An earthquake of 5.3 magnitude rocks part of Gujarat. No report of any major damage to property or loss of life. For details of these stories and more, log on to our website www.newsonair.com. And with that, we end the morning news. Have a nice day.